Hip injuries in the younger student athlete or the young athletic patient with an athletic injury is a different group of people to help take care of. Being able to relate to the needs of those patients, getting them evaluated quickly, fixed quickly, and back on the road to their early physical therapy regimens quickly is a part of what we do here.
Dr. Olscamp really came to my level and was able to explain it and make me feel comfortable and knowledgeable about what was going to happen.
It's definitely a rare thing as an 18-year-old at the time for me to go through this. He definitely connected me to what was going to happen, what the stages were if I didn't do it. If I didn't do it, I would have actually had hip replacement by the age of 40.
Subject of acetabular labral repair. In previous years, this was something that had to be repaired through open, large incisions. Now we can do it arthroscopically. Using a series of burrs and or shavers, we're able to clean up the edge of the cup and then reattach the gasket to the edge of the cup, thereby repairing the lesion and restoring you back to normal anatomy.
Came to college and I played intramurals and I ran and I worked out, and not being able to do all these things without having difficulty was hard. Especially being young and active, it kind of took away from my lifestyle. I was happy to get back to it, be back to being a 23-year-old.
Not being able to play my senior year of football and basketball, it definitely took a toll on my life as well. But Dr. Olscamp kind of helped me out through it, and now I'm able to play intramurals pain-free.
When I was young, I dislocated my left shoulder 5 or 6 times ski racing. That was a hard thing to get over. Being able to get someone back to participating in athletics and knowing that that's going to serve them for the rest of their lives is a pretty neat thing.